Today's video is all about a crucial topic, new blood sugar level guidelines. If you or a loved one are dealing with diabetes, pre-diabetes, or simply want to stay informed about metabolic health, this video is for you. We'll be breaking down the latest research, discussing how blood sugar guidelines have evolved, and uncovering some surprising truths that could change the way you approach diabetes management. The evolution of blood sugar guidelines. To understand the current recommendations, we need to look back at how blood sugar levels were categorized historically. In the 1990s, the National Diabetes Group in America set the standard that anyone with a blood sugar level above 200 milligrams per deciliter was considered diabetic. In 1997, this guideline was revised, and fasting blood sugar levels above 126 milligrams per deciliter were classified as diabetes. Postprandial, or after meal, levels above 140 milligrams per deciliter were also considered a warning sign. Over the years, these guidelines kept evolving, and more strict criteria were introduced. However, recent research has challenged these traditional values. Studies have shown that many people classified as diabetic based on these thresholds were actually not diabetic in a clinical sense. In 2018, the American College of Education, in collaboration with various health researchers, suggested reviewing and updating these criteria. The role of pharmaceutical influence. A major reason why blood sugar guidelines have remained stringent is the influence of pharmaceutical companies. By lowering the threshold for diabetes diagnosis, more people are classified as diabetic, leading to increased medication sales. This industry-driven model prioritizes profits over patient well-being. Many studies indicate that type 2 diabetes is not a disease of insulin deficiency, but rather one of insulin resistance. Yet, insulin-stimulating medications continue to be prescribed, which may worsen the condition over time. Long-term use of such medications has been linked to pancreatic burnout, converting many type 2 diabetics into insulin-dependent type 1 diabetics within a few years. Scientific evidence against over-medication. Numerous studies have been conducted to determine whether lifestyle modifications alone can be effective in managing diabetes. One key study divided participants into two groups, one treated with insulin and medications, and the other using lifestyle interventions like diet and exercise. The results showed that those who focused on lifestyle changes had a 22% improvement, whereas those relying on medications experienced worsening health over time. Another study demonstrated that a 10-kilogram weight loss significantly reduced insulin resistance, proving that diabetes can often be managed without medication if lifestyle modifications are prioritized. New blood sugar guidelines. Given the new research, experts are recommending a more lenient approach to blood sugar classifications. Here are the updated recommendations. Fasting. Blood sugar should be below 150 milligrams per deciliter instead of 126 milligrams per deciliter. Postprandial blood sugar should be below 180 milligrams per deciliter instead of 140 milligrams per deciliter. HbA1c below 6.5% remains ideal, but a range up to 7% may not necessarily require medication if other health parameters are stable. This means that individuals previously classified as diabetic under older guidelines may not actually need medication. Instead, they should focus on dietary changes, physical activity, and stress management. The role of diet and lifestyle. The primary cause of diabetes is not sugar itself, but an overall poor diet rich in processed foods, refined carbohydrates, and unhealthy fats. Western dietary patterns, dominated by highly processed foods, have led to an increase in metabolic diseases, including diabetes, obesity, and cardiovascular disorders. The solution lies in avoiding refined sugars, vegetable oils, and processed foods. Adopting intermittent fasting and balanced meals, incorporating regular physical activity, managing stress through proper sleep and mindfulness practices. Misinterpretation of morning blood sugar readings. Many people panic when they see high fasting blood sugar levels in the morning. However, the human body naturally releases stored glucose overnight, especially during dawn, which can slightly raise blood sugar levels. Instead of solely relying on morning readings, a better approach is to measure blood sugar before bed and in the morning, then take an average to get a more accurate picture. Conclusion. These revised guidelines suggest that diabetes is not simply a matter of high blood sugar. It is a metabolic issue that requires a holistic approach. Instead of immediately resorting to medication, individuals should prioritize lifestyle modifications. Pharmaceutical companies have played a major role in controlling diabetes treatment protocols, but it is time we focus on research-backed approaches rather than blindly following outdated guidelines. The real solution is in diet, exercise, and lifestyle changes. I encourage you all to share this information as it could change lives. If you found this video helpful, please like, comment, and share it with others. Let's spread awareness and move towards a healthier future.